Most men think of testosterone as the aggression hormone, as the libido hormone, as something that only belongs to athletes and men in their 20s. That's a narrow and inaccurate picture. Testosterone is a foundational hormone. It governs systems across the entire body. And when it falls below the levels those systems need to function correctly, the effects are specific, they're measurable, and they're far broader than most people realize. This video is about what testosterone actually does in the body and what the clinical literature says happens when it's not there. Testosterone is produced primarily in the testes, and it's regulated by a signaling loop that originates in the brain. The hypothalamus releases a hormone that signals the pituitary gland, which in turn signals the testes to produce testosterone. This loop, called the hypothalamic pituitary gonadal axis, is the governing system. Production peaks in early adulthood and it gradually declines after that. After age 30, total testosterone falls by about roughly 1 to 2% per year in most men. That rate of decline is perfectly normal. What is not normal and has a clinical name is when levels fall below the threshold that the body needs to function properly. That threshold is 300 nanograms per deciliter. Below that number, in combination with symptoms, that diagnosis is called hypogonadism. Here's what testosterone actually does in the body. Starting with lean muscle mass. Testosterone is the primary hormonal driver of muscle protein synthesis in men. It signals the body to maintain and build muscle tissue. When levels are adequate, training produces results. When they fall below the clinical threshold, the signaling is insufficient and muscle mass starts to decline despite proper training and nutrition. Next up is fat distribution. Testosterone influences where the body stores fat. Low levels are associated with increased visceral fat accumulation. That is, the fat that is stored around the abdominal organs. Now, this is not cosmetic because visceral fat is metabolically active and it's associated with increased cardiovascular risk. Next, we have red blood cell production. Testosterone stimulates erythropoiesis, which is the production of red blood cells. Adequate levels support oxygen delivery to muscle and tissues. And this is why energy and endurance are affected when testosterone levels fall. Next, we have bone density. Testosterone plays a role in maintaining bone mineral density in men. This becomes clinically relevant over time, particularly with men who have a deficiency for a prolonged period of time. Next up is cognitive function. Did you know that the brain has testosterone receptors? The relationship between testosterone and cognition is less simple than that of fat or muscle. However, the clinical association is consistent. Men with low testosterone report cognitive symptoms, and those symptoms are part of the clinical picture. And finally, there's libido, the fun symptom. Testosterone is the primary hormonal driver of sexual drive in men. This is the most widely known association, and it's accurate. So when testosterone falls below 300 nanograms per deciliter, confirmed on 2 separate blood draws in the morning because levels fluctuate throughout the day, the systems that I just described begin to show strain. Now, this doesn't happen all at once. It happens gradually, and this is why it's so easy to attribute these symptoms to something else. The fatigue gets attributed to a demanding schedule. The body composition shift gets attributed to age. The cognitive lag gets attributed to stress. The libido decline, now, that doesn't get attributed to anything because, frankly, it never gets discussed. By the time that the pattern is undeniable, most men have already been living with it for years. Now, there's one technical point that is worth understanding. Testosterone levels are not constant. They are highest in the morning and decline along the day. A blood draw taken at 2 p.m. will return a lower level than that same man's level in the morning. This is why the clinical standard requires morning draws typically between 7 a.m. and 10 a.m. and why a single draw is not sufficient to make a diagnosis. 2 separate morning draws on different days in combination with the symptom picture, that right there is the clinical standard. If you have had your levels tested in the afternoon or only once, that result might not be an accurate representation of your true baseline. Testosterone is not a performance drug. It is not optional equipment for men who want more from their bodies. It is a hormone that every single man depends on. It's needed to maintain muscle, regulate fat, produce energy, think clearly, and function in a relationship. When it falls below the level that those systems require, the consequences are clinical and they're addressable. If you want to know where your levels are, the process starts with a blood draw. Begin with the TRT Companion Panel at optimuslabs.com.